In October 2013, I was working in Aleppo, and I was working as a trauma surgeon, helping to deal with many gunshot wounds. One particular day, somebody had come in with a gunshot wound to his chest, and I went to see the patient and decided that he needed to go to theatre and have a thoracotomy. As we wheeled the patient through the emergency department into theatre, I was well aware that the whole place was cluttered with various people. I wasn't quite sure who they were, but we were about halfway through this operation, and suddenly the doors of the operating theatre burst open, and the operating theatre was full of men dressed in black, all with Kalashnikovs, which I suddenly had a cold shiver down my spine to realise that they were from ISIS. I've had a gun held to me several times over the years, and what you feel is pure terror almost, and you feel that your carotid arteries in your neck are pulsating, you feel as if you're starting to tremble, and you also feel that your legs are going to give way. I kept my head down. The Syrian surgeon whispered into my ear, "Don't say anything, just don't say anything." And the Syrian surgeon in English spoke to the leader and found out that who we were actually operating on was an ISIS fighter, and told him, "Do not disturb the senior surgeon," that was me, "otherwise your friend will die." And with that, they backed off slightly, but the leader stayed with us all the time and was watching me operating. I was filled with severe anxiety and severe terror. When you are in a situation where you have guns pointed at you, never look at them at all. Always look on the floor, look somewhere else. Because once you develop this eye-to-eye contact, then you form some sort of crazy bond with that person, and you've lost it. So I just took a deep breath in and concentrated exactly what I was doing and tried to forget what was going on around me. Luckily though, I think something must have happened outside. Somebody walked into the operating theatre, spoke to him, and then they all left in a pickup truck. After anything like this happens, you're in a state of stress, but then about 2 to 3 hours later, you have a feeling of complete and utter euphoria. It's an almost out-of-body experience.
Yeah, hi. David, so you were just a standard surgeon, and then you decided to go and volunteer in some of the dangerous, most dangerous places in the world. What was your decision-making process? Why did you decide to do that?
Well, yes, I qualified as a consultant surgeon, and I was working at Charing Cross, and this is many years ago now, 1992, 93. And I was watching on the television Sarajevo and the media building it all up, and there was a man who found his daughter underneath a load of rubble, and he took his daughter to a hospital, and she was seriously ill, and there was no doctor there, there was nobody to help her, and she died. And I watched this, and I thought to myself, you know, my heart suddenly just sort of leapt, and I felt something give, and I felt this fire started in my heart. And so I thought, I've got to go and help them. I've just got to go. And I'd only just started my consultant job at Charing Cross. I'd only been there about 6 weeks. And I went to the professor of surgery, and I said, sorry, I know I've just started here, but I've got to go to Sarajevo. And he said, no, you're not. And I said, yes, I am. No, you're not. Yes, I am. And so there was an Australian fellow who was working with us called Eric. And I said, Eric, if I promote you up to my job, will you do my job and I'll give you £2,000? Of course, all right, mate. Yeah. And and about 3 days later, I was in Sarajevo, and had an amazing it was just a fantastic experience.
So you weren't riddled with any fear. It sounds like you were really just that was it. I have to go. That you felt that obligation.
I felt a huge obligation to go. I felt an obligation to use the skills that I'd been taught over the past 10 years to become a consultant. And I felt that, you know, if there wasn't a surgeon there, then I was going to be that surgeon. Yeah, so that was
the way it had to be. Yeah. So this isn't just one-off volunteering experience. You've been doing it for 25 years. What was the first time you actually thought, or was there a first time you thought, I can't do this, this is too risky?
It is an extremely risky job. Going into a war zone, you have to be very savvy. You have to really understand the situation that you're in. You have to really be you have to put a different head on your shoulders, and you have to be that head that realizes that it is so dangerous. If you make one mistake, somebody's going to mobile phone, they're going to get kidnapped, you're going to get shot, something's going to happen to you. So you have to be sort of opposite to being brave.
Did you know you could do that before you went?
No. Well, when I went to Sarajevo right at the very beginning, I was a very young consultant, and I was very naive, extremely naive, and took risks that I would never take risks now, and I was very lucky to have got through what happened to me. Mm-hmm. I was in an ambulance being taking a patient from one hospital to another. The ambulance came under fire, the person in front was shot, and it was just an experience that I realised, that this is, I can get killed here.
It's real.
It's very real. And over the years, but the problem was that during these experiences, you do get this euphoric experience of thinking that you've courted death, but you have been able to survive. And it's an experience which gives you, it's like a drug really, and you want more of it and more of it. But you get to a stage really whereby you have to be very careful with what you're doing. And then you have to realise, well, what am I doing here? Am I just doing it for my own satisfaction? Am I doing it for my own pleasure? Am I doing it for this drug that I'm getting? And the answer is no. The answer is you're getting more experiences every time you go to a war zone. You're getting more and more and more experiences of how to deal with very difficult cases that come in. And you then are able to really work out the way to do it. It's completely different to working I've just come from St Mary's this morning, where we were dealing with a case where it had loads of blood, I had loads of everything else, and there were loads of people there, so I said, right, I'm going to a talk. And so I left them. But when you're in a war zone, you don't have enough blood, you don't have this. You have the same sort of case that comes in, but you've got to make very difficult decisions, which takes years and years and years of appreciating. And I think I started to realise this about 10 years ago, that I'm somebody now that's been to 15 war zones. I've got a huge amount of experience. I'll just keep doing it until I can get to a stage where I can really start to give back the experiences what I've learned.
So talk to us about that. What is it that you're doing to be able to give back? You've set up a foundation.
I did set up a foundation, and I went to the Royal College of Surgeons, and I said to them, I now have a vast amount of experience in humanitarian surgery, both war zones and catastrophic areas, and I would like to set up a training course to train surgeons. So we called it Surgical Training for the Austere Environment. So surgeons would come, and the Department of International Development gave us a load of money to set the course up, and we ran it 3 times, and all of a sudden nobody came because the course cost so much money, and of course it runs for 5 days, and I was able to distillate, if that's the right word, all the 25 years of training into 42 hours, so I could give the surgeons everything that I had learned all this time to train in a short period of time. But of course nobody came then because it cost so much. And so Ellie, my wife, and I set up this charity which is called the David Nott Foundation, which we now are doing very well, and it allows us to bring surgeons from all over the world to our training course. So we pay for their flights, we pay for their accommodation, we give them all the information, and they're both from war zones, they're from low-income environments, they're from everywhere. We recently, last week, we ran a course about 3 weeks ago. We had lady surgeons from Libya, we had Congolese, we had Cameroonians, we had Egyptians, we had all sorts of people from all over the world, and they apply for a scholarship and they come. And then the course that we've set up, which is again this training course, we have a team now at the foundation, and we've got models, we've got everything else, which we then take to the field. So rather than, if they can't come to us, then we'll give the training course to them.
But how, David, do you train someone, despite the level of their skill, because obviously they're already surgeons, that's not what you're teaching them, how do you teach someone how to go into an environment that is so full of risk that you don't even know about? You did not know in that situation there what was going to happen. How do you give people those skills?
Well, that's a very good question. And of course, what you do is you tell them, the risks that people do take are enormous. And if there are different environments you go to. There are sort of very hot environments where you're on a field hospital on the front line, and you can hear the gunshot wounds around, you can hear people coming in, you can hear the bomb blasts and so on and so forth. And that is a very, very hot environment. And you really need to have somebody who's cool, calm and collected in that sort of situation.
And can you teach that, or is that innate?
That's innate.
Yes.
I think that's innate.
Yeah.
I think that's something that if you make a mistake in those war zones, then time is over.
Yeah.
So what we try and do is the surgeons that we train are from those sort of places, but they're local surgeons, so they know what environment they're working in at the moment. So we bring them across, they go back to there. The other surgeons, like the expat surgeons like me, we would not put them in that environment because that is too dangerous for them. Yes, and so we would train them to work in that. We have links now with Médecins Sans Frontières, International Committee of the Red Cross, so their surgeons work with their organisations at their hospitals, which are away from the front line.
We've got some slides, actually, David, that we were going to show as well. Firstly, this is a slide of a little boy that you worked with.
Well, this epitomises, it's not a very pretty picture, I can assure you, but it epitomises what it is like to be as a war surgeon. So this little boy was in Aleppo 2014, a barrel bomb attack. He was about 4 or 5 brought in. He was going to lose his leg. Now, in a war zone, you can easily make a decision, if you don't have the experience, to just amputate. And of course, if you amputate a little boy's leg like that, the femur is going to grow. It's going to grow through the wound. He's going to get septic and so on and so forth. But if you have the skills to pass on to the other local surgeons, then you can make a huge difference. So the skills that I've learned of plastic surgery, orthopedic surgery, certainly for this case, pediatric surgery. And so in this case, what you see here is the little boy that's come in, and we've externally fixated his leg. We've put an external fixator for his orthopedic injuries. And we've taken a vein graft from one leg because he had no circulation to his foot. And we've revascularized his leg using the vein from his other leg to make it into an artery. And that's the other picture. And then, of course, you need to cover that with plastic surgery. And you go back to 40 years with Mackinder and everything else. The surgeon that did lots of surgery in the Second World War. You use his techniques because you can't use the techniques now. You can't do free flaps. You have to use the old techniques. So you go the old techniques and learn years and years ago, which were good. And you cover that. And then you have a little boy that 3 months later is able to walk. And those are the skills that you need to pass on. You need to pass on, certainly for that case, orthopedics, vascular, plastics, and pediatrics.
So you're listing skills, okay, which of course you have in abundance. We're talking also about decision making, and which you are able to do when you're more informed, as you say. But what happens when that decision making is forced, when you have someone holding a gun to your head? You're not a stranger to that. That's happened to you a few times.
Yeah.
How do you keep yourself together in that situation? Or talk us through any other examples that you have.
Yeah, well, I suppose one example I can have is not in the hospital, but it's in. I was going to a checkpoint in the Congo, and again I was at a checkpoint, and the issue is at the fact that a man at the checkpoint had a gun. He was high on drugs. He was high on whiskey, everything else, and I could see him coming towards me, and I tried to put the window up like this, too late, and the gun came through and went onto my neck. And of course, then you're in a situation whereby, what do you do here? What can you do? And you're not in the situation whereby, it's not like Hollywood, where you open the door, bang, like this, and you bash him on the head. It doesn't work like that. You go into this sort of catatonic state of apoplexy, and you sit there and you realise that, this could be the end. So you work out mechanisms in your head to say, okay, how am I going to get around this fact? And luckily, at the time, there was the car had a guy in the back who could speak his language, and so he spoke to him, and I gave him my wallet, I gave him my phone, I gave him everything he ever wanted to let us free. But it's those situations whereby you are in a state of total and utter panic and anxiety. But you just have to sit there and you just have to really feel that you can get over this.
You talk about radiating serenity in your book.
Yes, you just have to radiate some sort of serenity, both to who's in the car with you, who's next to you, and the driver actually in that car ran off. So there was just 3 of us left in the car, and I had to shimmy over and drive the car, which was very difficult.
So, wow. I mean, one of the things that you do as well, David, especially at the beginning, is you go find yourself in an environment where you weren't known, people hadn't worked with you, they don't know your skill set, and you're coming in, you're trying to get people to trust you to make big decisions. How did you go about that?
So again, when you do go to a war zone, or you go to a place where you go to a hospital, everybody looks at you as if, you're a stranger. What are you doing here? Are you a spy? Are you, do you have the skills to do the job? And what you do is you just go into the operating theatre and you just stand there and you just assist and you just basically become friends and you don't do anything. And if things are going slightly wrong, then you'll say, do you think I can just show you something here? And you get the scissors and you get the knife and you said, I would do this with why don't you just do that? And they go, oh. And then all of a sudden you build confidence, and you build confidence slowly but surely. And then when you have the confidence, then they realise that you are their teacher and that you can teach them things which are going to significantly revolutionise their life. There was a picture just up now of when I was in Aleppo, and when we arrived there in 2013, they had an 80% death rate. All the senior surgeons had left, so you got this young group of surgeons that were dealing with the most dreadful of casualties. And so doing the teaching and doing the training, we got down to 3 weeks. We had no deaths at all in that period of time. And that was 10 to 14 gunshot wounds a day. It was quite dramatic how you can, with care and attention, get through.
And create the right environment for people to be able to...
And that picture there is, there's a guy there holding a gun who's the most craziest man I ever met in the world. And he would take us around in an ambulance. And so at the time, because Aleppo at the time was, there were few hospitals and they all needed training. So if they had a case that needed somebody to come and show them how to do it, then that guy there was the ambulance driver, Abu Abdo, and he would sit in ambulance and we'd be driving around all these hospitals showing. And even at night time, he would drive without any lights on because it was so dangerous to drive because there were planes in the air trying to shoot cars that had lights on. So we would drive around completely in the dark. It was a wacko experience.
Amazing, to say the least. And there's a story about Aisha. Is that the right? Could you tell us about this story?
Yes, so in Gaza 2014, I was in a situation whereby a little girl had come in and she was on the operating table, and because I'd done a lot of paediatrics, and I'm sorry about this picture, it is a difficult picture to look at, but this is what you see in a war zone, this is what you actually will see. And this little girl came in, she was 7, and she had evisceration of the bowel. You can see her bowels hanging out from a fragmentation wound, and the fragmentation wound's gone through the bladder, colon, spleen, and stomach, and also gone through her arm, and if you look at her, she's dying. And I went in and I prepped her up to operate, and a man came into the operating theatre and said, David, we have to go now because the hospital's going to get bombed any moment. And so what decision do you make then? You're in the operating theatre, you've got this little girl in front of you who's dying in front of you, and somebody comes in and says, David, you've got to leave, you've got to go. And of course, I put it to anybody in this audience really, what would you do in that situation? If you had the skills to operate, if you had the skills to save her, would you save yourself for another day, which is quite a good thing to think about, or would you stay with her and realise that she is going to die if you don't do something? Do you stay and operate, or do you leave? And I could not leave her. I just felt that, why should I be bullied? Why should I be told what to do by some person who's sitting in some plane upstairs, who's flying around and pulling a button and going to blow me up? Why should I be at his beck and call? And these things were going through my mind at the time. And it wasn't being brave. It was just that how can I leave a little girl like that to die? So anyway, so I stayed there with her, and I asked the anaesthetist to put a tube down and ventilate. You can go if you want, and he said, no, I'll stay with you. So the two of us just stayed, and as I was prepped her up and as I opened the tummy up, I was just waiting for it to happen, but it never happened. And there she was with me about 3 days later.
I wonder, when I hear you speak, if someone had said to you, like you're asking us, would you stay, would you go? Do you know the answer? Would you have known the answer of yourself before this situation?
I don't think you can ever.
No.
I don't think you can ever know the answer. You have to be in the situation whereby it is so profound that you will lose your life if you stay there. Will you lose? Would you do it?
Yeah. I think people can often underestimate what they're capable of, though.
Absolutely.
And if someone had asked you that, you would have maybe said, no, I don't think so. Until you're in that moment, you don't know.
You don't know.
But these extraordinary conundrums that you're finding yourself in, they're not normal. They're not average. Do you keep seeking more? No, seeking is the wrong word. Do you keep finding yourself in more and more of these? Are you going back and volunteering more and more?
Yes, I mean, I'm off to the Yemen very shortly, and I was in Cameroon, and I was in Kenyan-Somali border recently as well. I mean, I'm teaching people how to operate now, and I'm teaching people on their cases how to do their surgery. So it's leaving a legacy, really, of that. But it's a matter of, just we all have it inside us. And the other speakers that I've heard this morning, which I'm just so amazed at, we all have it in us to do amazing things.
Things we don't know we can do.
That we don't know we can do.
Remember when I was injured, I had a spinal injury, and someone said to me, if you'd been told that you were going to never walk again, what would you have done? And I remember thinking, I wonder what I would have done. I don't know if I would have wanted to live my life. You don't know until you know.
Exactly.
But what other advice might you give us? I'm going to keep pushing you.
There's another picture there which I was going to stimulate me to say something.
Another picture? The picture we just had?
Another one after that, I think. There was one after that.
The group picture?
Oh, okay. This is teaching surgeons in the Kenyan-Somali border with our instruments, and these are a load of surgeons who I'd spoken to and taught in Yemen at the start of this year. It's a wonderful thing to give back things to people, there's no doubt about it, and it's, I think the social media we have now, WhatsApp and everything else, is a great thing to keep making big families of people, and we all keep in contact with everybody now. I just think.
That's a way to put it, making families.
Yeah, it's like a global family we're trying to create anyway, and I just think that it's just, I don't know what to say really. I think it's a great thing to be able to, if you've got a skill and you can use it, then why not use it to the full extent of what you can
Fulfill
do?
your potential. Is that what you mean?
Fulfill your potential.
Okay.
Yeah, it's very easy to. A lot of my colleagues will sit and say, "Well, I'll never do that date." But the problem is that there's a whole world out there that you can change significantly by just, as one of the speakers said, just go and do it. Just wake up and go and do it.
And it's interesting you speak. We've heard earlier from some people talking about just being yourself, and that will be enough. But you're also talking about learning skills to take you forward, whatever it takes.
You have to be the right person. You have to be the person that is able to give those skills over. You have to have the right temperament. You have to have the right personality. You have to have all these skills. I mean, on Monday night, I was just cycling back from St Mary's, and I got called and said, "Is that Dr. Nott?" I said, "Yes." He said, "You need to come to the Portland Hospital now. Are you a vascular surgeon?" "Yeah, you need to come now." Oh. So I just cycle there. And I got to the Portland Hospital, and there was a lady on the operating table who, again, was dying. She was exsanguinating from they could not get down to a bleeding blood vessel in the pelvis. And I used a technique which I'd learned from my war zones, which was taking a piece of the lining of the abdomen, and you create these little things by putting in stitches, and you create it like a pledget, so that when you put your stitch down and you stitch the vein which is hosing blood out, and you use your pledgeted stitch, which has this like square on it, you can tamponade, you can put these things together and stop the bleeding. When I got in there, they'd had 14 units of blood. There were 4 surgeons there. Their blood pressure was really low. And I said, "Okay, give me a pair of scissors, please." Calm, took the piece, put the square, and put the stitch in the square and went, and it stopped. And they went, wow. And I would never have learnt that had I not been to war zones.
No.
And so the skills
So put yourself into the risk.
Put yourself into the
You'll
risk.
grow out there.
Yeah.
Amazing. Unfortunately, we don't have time for questions. Are you going to be around? I mean, you're going to get
Yes,
bombarded
yes.
if you are. Sorry. I'm just... David Nott, thank you. Thanks, David.